Hi, I'm Dr. Kurt Woeller. I'm often asked, what can be used for things to reduce fevers? A lot of kids are given Tylenol as sort of the mainstay as a fever reducer, either when they're sick or sometimes parents are given that recommendation prior to taking Tylenol, prior to getting a vaccine, or if they've had a vaccine and they're getting a fever to take Tylenol. There's actually been some research that has shown that Tylenol can be suppressive on a chemical called glutathione. Glutathione is the most abundant, most powerful antioxidant in our body. Glutathione is important for protecting our cells against toxicity. It's also important for helping to support detoxification, has a regulating function over our immune system, so it's a pretty important chemical that our body needs, and for many kids they're actually deficient in glutathione. So generally I don't recommend Tylenol as a fever reducer. If we need to use a fever reliever at all, then what I will tend to use is ibuprofen, which is it's not going to have that suppressive effect on glutathione like Tylenol, and is generally effective. Now the question comes up, when do you really need to reduce a fever? Generally a low fever, 100 to 101, 101.5, even sometimes 102 for most kids is not going to really warrant having to reduce their fever unless there's some situation of a febrile seizure history, or concerns such as that. In many kids, the fever, in most people, the fever is actually our friend because it shows that the immune system is active, you're having increased metabolic activity, increased enzyme turnover to just help overall with the immune system and the fighting of that infection. So just automatically reducing a fever is not always helpful or advantageous. Now, the policy I've always had, is if a child is just lethargic and they're not eating, they're not drinking, and they're really, really miserable, or if they're not sleeping because they have a high fever, then certainly using something like Motrin to bring it down can be advantageous because sleep is critically important. Okay, if there's a history of febrile seizures, certainly. If you're getting fevers upwards of 102.8, 103, of course, at that point, most kids and most people are going to be pretty miserable. So I would look to reduce a fever at that point. And clearly, you want to be able to discuss these things with your child's pediatrician or family doctor as well. So the thing about Motrin is it's not as long-acting as Tylenol. Tylenol many times has an effect upwards of 6 hours or more. Tylenol, you're usually looking about every 4 or 5 hours. So in some kids through the night, they're not maintaining a fever reduction just with Motrin. What I always tell parents is, if you're going to use something to reduce fever that is a over-the-counter medication, the first choice I like is the ibuprofen. If the fever is not breaking, your child is absolutely miserable, and it just, the Motrin isn't helping, is it the end of the world to use a dose or two of glutathione? In my experience, it's not. But I would use it in very select circumstances. I try to avoid it as much as possible. I don't like to see Tylenol given for a child who's going to get vaccines to have to taking Tylenol automatically before they get a shot, just so the fever is being reduced or the fever doesn't come about at all, or to use Tylenol after vaccines. So you can, from my experience and from my personal feelings, Tylenol is something that I use very, very rarely, and if I was going to use anything at all, it would tend to be Motrin. There are different homeopathic remedies. One remedy that can be used for acute fevers, something that comes on very, very quickly, is a homeopathic remedy of belladonna. And belladonna as a homeopathic remedy can be found at most health food stores. A low dose, a 12C, a 30C, sometimes given once every 20 to 30 minutes for a couple hours, many times will help reduce fevers naturally. There are other homeopathic remedies out there for fevers too. The list is way too long to go into it in this kind of a video, but there are some natural things that can be done, and belladonna as a homeopathic remedy is one of those. So I hope this information is helpful for you. Again, Motrin over Tylenol, from my experience, Tylenol very sparingly, if at all. And then, of course, for acute fevers, what can be tried as a natural remedy called belladonna as a homeopathic remedy. Thanks.